well. And so, yeah, that's a little bit about the topic today. You'll hear from a number of great speakers, great advocates, and so looking forward to hearing from them. So without further ado, it's my pleasure to introduce you to, I just wanted to check the phone user 306. Is that you, Terry?
Yeah, that's Terry.
That's Terry? Okay. I'm just going to introduce you quickly, Terry. So just introducing you to Elder Terry Gardner, who's joining us from Saskatchewan to say a few words about today's forum. Terry is Métis from Northern Saskatchewan, where she is a health advocate specifically for people living with cancer. She dedicates her time to educating and supporting Northern people as they access cancer treatments and supports where they live and in the southern cities as well. From 2019 to 2022, Terry was a member of the Saskatchewan First Nations and Métis Organ Donation and Transplantation Think Tank. And so without further ado, I'll hand it over to you, Terry, to welcome us. Thanks.
Good morning, Tinigi, Craig. Can you hear me?
Yeah, I can hear you perfect.
Okay. Thank you so much for the introductions. Like Craig said, I am from Northern Saskatchewan, and we must always honor the ancestral lands we stand on. As an elder, every day we have to, as Métis people and First Nations, we practice our 7 grandfather teachings, which of course is love and respect, trust and honesty, courage, wisdom, and humility. We have to live by this and help each other. I'm going to pray in my language, which is Cree, Northern Michif, and you can pray however you want. We'll say our prayers in a good way to help us with this important subject we're going to be talking about that Dr. Caroline Tate is bringing us. Organ donation, that's so important amongst our people for their quality of life. And living in Northern Saskatchewan, because of the geographical region we live in, our people are really suffering. My mom, well, she's passed away since, but she was on dialysis, and the numerous trips and the cost to go to the city, to Saskatoon, has really taken a toll on her, and then she ended up passing away. So with that, I'm going to start my prayers. No taunan, kihtigisugukan tuhtauyo muuta hanuskama maapia kawaskapia. Witihinan tamio mamtoni ihtama, tamio mamtoni witahayahko apitogusanak. Minuskituinuak tamamoatuskia tapto tamio ihtama tawitihittuja. Higwigakitamaksitik nitini hiawak. Ikwa nistangik kihtiin mantu higigivitihien mantuskamuut. Tahtogisigaw kemamsito tatin tatamskatin mantuanuskagisigak. Iguhi iwitihi situskauja ni hiawak tagaguohpinsuja. Ai pues mamoapia tawitihituja nuskawe mamo askapia uti mamoapia tantuhtatuja tawi ikwa awiak kigwegak kihta tama tawihtamuaya koon kitaisini nanak. Iksuman anuska punaya mahayota mantu piskim nanan gimina kapmuti hutik papia taktatatagiwitik. Hi.
Thank you so much, Terry. Egosani, Terry, for sharing that prayer with us. And I'm also just holding my tobacco too, because hearing these messages and hearing what you had to share too is important in getting us started and remembering about all of our relatives, all of our kin across the lands of Turtle Island and in this work. And so thank you for sharing that prayer with us, Terry.
Thank you.
As noted earlier, today's cafe is hosted by CDTRP's Indigenous platform, which is led by Dr. Caroline Tate. Caroline Tate is Métis from McDowell, Saskatchewan. She's trained as a medical anthropologist with research interests in addressing Indigenous health inequities and advancing social justice. Her area of expertise is in the health and wellness of Indigenous people in Canada. Within ODT, Caroline focuses on health inequities experienced by Indigenous people that contribute to end-stage organ failure. She is a professor at the University of Calgary's Faculty of Social Work. And I'll now turn it over to you, Caroline, to share a few words.
Good morning, everybody, and thank you for being here, and thank you, Terry, for the opening. Terry and I go back a long way, and have worked together on different things. And I don't know anybody who is more dedicated than Terry is to helping her people. Terry shows up every day, and that means a lot, right? She shows up every day for her people, and is just an incredibly remarkable person. Some other remarkable people that I want to acknowledge, Manuel and the CDTRP team, but Manuel has gone above and beyond. And then Craig joined us as the moderator, which we were thrilled about. And so I just want to acknowledge their contributions to today. It has been such a pleasure working with both of them and with CDTRP. I want to thank the Canadian Institutes for Health Research and the idea of the Café Scientifique, which is to bring together people to share knowledge. And the knowledge that we're going to share today is coming from people with lived experience and people who work in this area. It's a beginning for what I hope will be a much larger conversation. Organ donation and transplantation does not receive a lot of attention as a health issue for First Nations, Métis, and Inuit, and even within our Indigenous leadership, it doesn't receive attention because of all the other demands on the time of our leadership, other pressing issues. So today, what we would really like to do is to raise that awareness as well. I also want to just say a quick thank you to the Faculty of Social Work, and where I landed for the last part of my career at the University of Calgary, and how wonderful the Faculty of Social Work and the Cummings School of Medicine, what a wonderful place it is to work. And so I just want to acknowledge that. So I'm going to turn it over now to Patricia, who's the head of, hi Patricia, who's the head of CDTRP, to say a few words on behalf of CDTRP.
Thanks very much, Caroline. On behalf of the Canadian Donation and Transplantation Research Program, welcome everyone, and thank you for joining us. So I'm, as mentioned, I'm the Executive Director of the CDTRP, and I'm joining you as a settler on Treaty 6 territory in Amiskwaciwâskahikan, also known as Edmonton. This is a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others. CDTRP is proud to be supporting this event and to be supporting Dr. Tate in the development of the platform for Indigenous health equity and justice in donation and transplantation. We see a role for CDTRP in the difficult process of truth and reconciliation, and doing our part to address the TRC calls to action. So as stated in the calls, we recognize that the current state of Indigenous health in Canada is a direct result of Canadian government policies. And the TRC also calls for increasing the number of Indigenous healthcare professionals and increasing cultural competency for all healthcare professionals. How we interpret this call in our world of research is working to increase capacity among Indigenous scientists and anti-racism work and allyship among non-Indigenous scientists. We believe that research has a critical role to play in first understanding and then addressing inequities in donation and transplantation and the burden of chronic disease among Indigenous peoples. And this is work we're committed to supporting. So we are here for hard conversations about power, resources, and what reconciliation means for our domain of research. So thank you everyone again for joining us today, and I look forward to the presentations and discussion. So back to you, Craig.
Great. Thank you, Patricia. Wonderful words, and very grateful for the support of CDTRP in today's cafe. So before we get started, I want to share just a few housekeeping notes. So you might have seen the recording session information pop up earlier. So today is being recorded, and the recording will be posted on the YouTube channel for CDTRP. During the presentation, please keep your microphones off, and I encourage you to keep your cameras on, especially during the discussion portions of today's sessions. Please note that we will do our best to answer all your questions. Though we'll adhere to the schedule as closely as possible, and I'll also be monitoring the chat. So if you have any questions, you can type them into the chat box, and I will take note of them. And when we're in the discussion portions, you can also use the raise hand button, and I can come over to you as well with your questions for any of our speakers today. And sorry, I just need a quick shot of water here. All right, so just wanted to share a little bit as well, just waiting on an attendee and a confirmation of something here. So I think just to get started, I was just gonna say that I had mentioned earlier that this coming October will be 12 years that my brother and I's kidney transplant has been a successful one. And that's part of the reason why I agreed to moderate today's session, is just how close it hits to home, how I've seen kidney disease and organ donation and transplantation affect my family. And so just to share a little bit about my story quickly is my brother was diagnosed as a young person. He was around 10 years old when he was diagnosed. And they figured he would have until his 30s or so, until kidney failure, but that happened much quicker. And when he was in his late teens was when the kidneys started to really near end stage kidney failure, and so that's when he had to go on the dialysis to be put onto the donor list. And during that time, obviously we had reached out to a number of our family and friends, and raised awareness around kidney disease and what the next steps were as well with Kevin. And so there were a number of people who went through testing, to be potential donors, and I think there was upwards of like 10 people, friends and family, and my uncle and myself were the two best matches for my brother. And so my mom and dad were also having some health issues at that time, and so my uncle agreed to go first with the rest of the testing, and found out a bit later on he wasn't a viable candidate to be a donor. And so I went through the testing next, and just remember it taking upwards of like 6 months, 8 months to kind of get through all the testing. And I'm somebody who lived in the city, right, in Winnipeg, and it still took quite a while to go through all the testings. And something that I remember specifically around testing was the testing with the psychiatrist, the psychologist there as well, and just the question around trying to ask me questions as well, and asking me questions around if I was doing this of my own volition, or was I going to receive any payment or receiving any monies to be a donor. And I understand the question around that as well, and but that's definitely not something that was top of mind or something that I was considered would happen. Being a donor was, somewhere to offer me money to do that, but that's just something that sticks out in my experience of going through, the organ donation process was that something that really stuck out in my mind, and so that's something that I still share, is just that part of the testing and just the time it took to get on. And so eventually, we went through all that testing, and our date. I know Kevin, my brother Kevin, shares it sometimes too, but I remember we'd gone through all the testing, and the last test was going to the doctor and seeing the results of my my scans, and seeing what my kidneys looked like, which one was the best option to consider for the transplant, and seeing that I had the left one was the best option, and it was my mom and I who were in that appointment at first. And I remember when we came out of the hospital, my brother and my dad and some of our family and friends were waiting as well. And I remember crossing the street, and it's funny to think back on it now, but in our Indigenous communities, we often have a lot of humor and joking around, and maybe it was a little bit of a darkness, but I pretended that kind of had a sad face on, and my brother was like, "Oh man, oh no, what happened?" And I said, and then I smiled and turned and said, "Nothing happened. Everything's good. The kidneys good to go, and we're gonna have a date selected for us to go." And just having that experience and feeling that that little bit of joy towards the end of our session there, and our appointment with the doctor. So I'm just taking a look at my chat here for a moment. Next, I think we're still waiting on somebody to come in, so I'm just going to introduce our next speaker here, and I'll say we're going to move on to Celia Deschambeault for a presentation about experiences of northern and remote communities. And so just to give a brief biography of Celia, she's the Director of Education for Nisto Awasisak Memorial School in Cumberland House Cree Nation. She has worked in the area of education for the past 20 years with a particular focus on language revitalization. And her passion lies in supporting Indigenous people in their pursuit of language programming and creating resources. Her work includes creating an avenue of prioritizing Indigenous knowledge as a foundation for Indigenous education. Celia is also an advocate for access to dialysis and transplant services for Indigenous patients in Saskatchewan, rural and northern communities, after seeing the challenges her uncle experienced in accessing dialysis outside his community. In 2011, Celia donated her kidney to her uncle. Celia, thank you for joining us today, and I'll pass it over to you.
Tanse, Celia Deschambeault Nitsnigason, Kaministigo Managaskak Ninoche, Maske Genonina. My name is Celia Deschambeault. I am a Swampy Cree woman from Cumberland House Cree Nation. I've lived here the majority of my life, with an exception of having to leave for post-secondary. I believe I have slides, if you can put that up. So I have been an advocate for dialysis and access to dialysis for many years. I've experienced not just through my uncle on my paternal side, but my two uncles on my maternal side. But I'll go into, maybe if you can advance the next slide, please. So this is my community of Cumberland House. It is about two hours away from any type of access to healthcare. We do have a local clinic here, but it does not have it doesn't fulfill the needs of our community. So the top right corner is the northern village of Cumberland House, and that's where I actually reside. The top left corner is the Portage area, which is a part of Cumberland House Cree Nation. And the bottom picture is the Cumberland Delta, the second largest inland delta in the world. And I always start off with my community because we have many issues with healthcare in our community. And like in particular, just a few days ago, my aunt got airlifted out. There's no access. Like when we talk about Nipawin, the nearest place, they don't have the same. They don't have the needs to, like, they don't have the facilities to fulfill the needs of what we need in our community. So if you can go on to the next slide, please. So this is my family. I have 8 children. My youngest daughter, Faith, is actually going through renal failure as well. It's been a really difficult time for us because, I'm a kidney donor. And now my daughter is probably going to be needing a kidney soon. Her left kidney has it doesn't work anymore. So she's at 80% with her right kidney, but she's having issues. She is 13 years old now. This picture, she was only 11 at the time, but she's 13 now, and we're seeing more and more issues. And because we're in a pretty northern community, the nearest place that we go when she has her appointments is 5.5 hours away. So the drive, we usually have to go the day before, and then she has her appointments, and then any follow-ups are in Saskatoon. So it's a long process for us. The bottom picture are my late grandparents, my late mom. My mom passed away from kidney failure when I was 18 years old. So with my choice to become a donor was based on us not being able to help her, and seeing that support that she needed, we weren't able to do that. And so when we talk about, the reasons why we do this is because of her, because of my daughter, and because of my uncles that have gone through the processes, and seeing all the issues that we have because of, the location that we're in and the lack of services that we have. So Niwagu Maganak, those are my family. And we use our Cree words because there's a strong meaning in our languages, and Wagutwin, which ties who we are as Indigenous people. Next slide, please. So I'm going to give you just kind of a brief overview of some of the things that we have to do. I use this to just give you a highlight of how long it takes to access services. So I know this is not unique to our community. It's even probably more dire in northern communities that only have access by plane or boat or whatever it is. But when you look at how far it is to do this, so I was actually director of health services for Cumberland House Cree Nation for a year. And this put things into so much perspective for me because I was able to see, because we covered transportation, and we were able to see how many people that we had going out and to the locations that they were going. Now I put Nipawin here. They don't have dialysis services, but that's the nearest place that has a hospital. And so when we have emergencies, the first place that they are usually taken to is Nipawin. It's a 2-hour drive. And so if you have life-threatening issues, 2 hours is still a long ways. So Tisdale is past Nipawin. It's about 2.5 hour drive. This is where some of our dialysis patients go. Now, many of our dialysis patients come from low-income families. So, we have NIHB that helps support the taxi services, but sometimes when they're going, they don't have money for food. It's a reality here. The other places that we take our patients, or at that time when I was working for health, was Prince Albert, which is about 3.5 hour drive. So when you start thinking about those drives and how long it takes to get there and how long the actual services take, it's full days for them. The next place that some of our patients go to are Saskatoon, which is about a 5 hour to 5.5 hour drive, depending on weather. Again, these are dependent on weather, giving you the best scenarios for road conditions. Sometimes Nipawin can take you up to 4 hours if there's a blizzard or if there's raining and our road is not the best road. So there's issues just from the road conditions and the distance. Next slide. So this is usual typical. So I kind of just picked Tisdale. So most of our patients were going 3 times a week. and they're going for 3 hours to 5 hour treatments. So if you think about a typical day, somebody going to Tisdale, they're traveling for about 5 hours to and from Tisdale. A 5 hour treatment, if it takes that long, it's a 10-hour day. So by the time they come back home, it's usually late at night, and they're wiped out the next day. So this goes on almost every other day. So their downtime when they're not on dialysis, they're tired. There's not much they can actually do. And I've seen this with my uncle myself. I've been around him a lot, and I always ask questions and started talking to him. He was so wiped out all the time. He ended up moving to PA during his last year of when he was receiving dialysis, because of the travel was just wiping him out completely. He said he had no life. The only time that he really did anything was maybe in the evening, when he wasn't on dialysis for a few hours visiting, and even that wiped him out. Next slide. So I'm going to just tell you the brief story of how I became a donor for my uncle. And our story is not unique. This is reality for all of our northern communities and many of our people that have to undergo this type of situation. So when I was expecting my last child, this was in 2010. This would have been July, because it was during our local sports days. And I had come home. I was actually working out in North Battleford at the time. And so I'd come home to visit, and I went to the sports grounds, and he was working in the kitchen. And so I sat there with him, talking to him, and I noticed his veins. And, reality, I haven't really looked at, when somebody's going through dialysis and what it does, right? So I was looking at his veins and started asking questions. And I had asked him, did anybody even try to become a donor? He said, no. We come from a large family, so that really surprised me. So I told him, okay, when I have my baby, I'll go check. And he said, okay. Later on, he told me, he said, I didn't want to get my hopes up. So I always tried to be impartial every time somebody said something. He said, I heard it so many times as well that I didn't want to get my hopes up when you said it. So I was living in North Battleford at the time, and I happened to be at a meeting in January. So my daughter would have been 4 months old at the time. And so I thought, okay, I had to go to St. Paul's to go visit an auntie. So I was thinking, okay, this is where the clinic is. So I'll go ask some questions. So I went up there to the clinic, talked to them, asked them questions about what I needed to do to become a donor. And so had those conversations. They told me what I needed to do, made an appointment 2 weeks later, and went back, got the blood work done. They talked to me about different things. I had to meet with a counselor to see if I was, mentally, I guess, stable to do this whole process, not realizing, the impact that it was going to be, like the impact on my family and the impact on my uncle's family, and just all those different scenarios of what could and couldn't happen. And so 2 weeks after that initial appointment, they called me and said we were a match. And they also said it's very rare that an uncle and niece would match. So I started the process, getting everything done. And it took, it was about a different procedure every month, or a different test every month, just to make sure that I was healthy. And so every test I would pass, I'd call my uncle and I would let him know, I passed this test, and same impartial tone, didn't want to get his hopes up. And so everything went well. And on that October of that year, I got a call, and that call was that we had a surgery date. So I talked to him before I spoke to my uncle, and we went through one more it was the last test, and it was a TB test, and I failed that test. And it was something that almost stopped everything. But and it was basically, you have the germ in your body and that type of stuff. So they had a big meeting with all the with the surgeons, and had a meeting with health providers, and they talked about the situation. So what had ended up happening at that time was they talked to my uncle and said that you need to sign a waiver that if you contract TB later on in life, that they're not held liable for that. So he signed the paper, but he still didn't know we had a date. We were just going through the process because I didn't want to get his hopes up because that test needed to happen. And I mean, the result or whatever the impact of or the outcome of that test needed to go, we still need to go through that. So they phoned me back, and this was just around Halloween. And I remember because my kids were getting ready for Halloween and that type of stuff. And they gave me a specific date, or they gave me 2 dates actually. One at the beginning of November and one toward the middle of November. And because it was such a short time frame with that first date, I what they said to me was, think about it, call us back. These dates fill up. You need to let us know. So I hung up the phone and I sat there for about maybe 10 minutes, really thinking, okay, this is really happening. And you don't know how it feels until it actually does happen. And so it was a mix of emotions. I was afraid, I was scared. And because I didn't know if it was really going to happen. And then knowing that it was going to happen really, really made me think things through. After that 10 minutes, I called them back and asked for the second date. And then I asked them, can I tell my uncle? And they said, yes, you can tell him. So I booked that date. I called my uncle. First, I called my aunt. I remember I wanted to let her know that's my dad's sister, and called her because I need to know where he was. And she was I remember this, she was at the school. So I had called her and she started crying because she said, she said, I didn't understand how somebody could just, be willing to do something so big. Right. So we had that conversation, and then I said, I want somebody to be with him, when I tell him, the good news. So she went over to see him, and then I called him. And so we had a little small talk, and then I told him, we have a date. And then he said, he didn't say anything actually for a few minutes, and then he started crying. And that was the first time that there was any emotion attached to, letting him know all this stuff. And I hadn't even contacted my employer at that point just yet, but they knew that I was going through the process of checking to see if that I was, through this whole process of becoming a donor. So I called my workplace, let them know the situation, and they gave me time off with pay. Not too many people are going to do that. There's a unique situation for them, and they hadn't experienced that before, and they understood the importance of Wagutwin, family, and they supported us through the whole journey. So come that time, I hadn't seen my uncle up until I didn't see him because I was living in a different community from Cumberland at the time. And so he was taken to Edmonton. That's where our donation took place. And so I hadn't seen him. I hadn't seen him from that point we found out to the point where we met in Edmonton. And so we had supper that night before, but he wasn't present because he was not taking his last dialysis. So we, going through, talking to my family that were with me, and, there's a lot of emotional pieces. There was a lot of crying. And so I had to actually report to the hospital at midnight because I need to be hooked up to IVs and that type of stuff. So, and I remember this clearly, walking, and it was kind of a steep, it was a ramp, and I was going up that ramp, and I had my head down. And so I'm walking there and full of emotion because I wasn't sure what this was going to be, this major surgery that I was going to, undertake. And I look up and Michael's standing there. So he said, sorry, I didn't think I'd be emotional after so long, but he said, I don't know how to repay you. Nobody's ever done anything this big or this, good for me. And so he hugged me. And when we walked together, and then I was taken into one room, and, he had to go back to go do whatever things. Fantastic. So from there, I didn't see him until that next evening. And so this picture is actually that evening. And that was our first time seeing each other after surgery. And so when I look back at this day, my uncle, that was the first time I seen him like really happy. He had to go through a lot after surgery. I was okay. It took me about 6 months to fully heal, to fully be active. Like it took a little while, but I didn't have to take all the meds that he had to take. And so he went through a lot to become healthy again. When I say that, because a transplant patient has to go through, like they take so many medications, and I know many of you are probably aware that they take so many medications and anti-rejection meds and that type of stuff. But that day, I remember the surgeon coming to talk to me after, when I was awake, finally like fully awake. It took a while because being sedated and coming out of the sedation took me a while. So that evening he'd come talk to me and he said, never have I ever experienced a kidney work so quick. And he said as soon as everything was hooked up to him, it worked immediately. And they don't usually see that. It takes usually a few hours, but he said everything just started working. And he said everything was meant to be. The surgery took long. He said you had so many kids to kind of move things around in there, but he said everything just went smoothly. Like everything just connected smoothly. And so yeah, like my uncle now is working full time. We had talked about we'd see each other every so often after surgery, and I would always ask him, how are you doing? And he said, I'm doing better. Like every time I seen him, he was doing better and better, weaning him off and making sure that he had the right meds. So when we talk about these things, really look at the the realities of everything. There was a huge expense attached to coming and going. Like when I went to Edmonton, they did cover my travel, but that was about it. I didn't get anything else covered other than getting there. My family also weren't supported, right? So anybody that was with me was on their own, own dime. The other part of that too was he had multiple appointments that he had to cover on his own afterwards. So anytime he went in, it's like I said, it took a while for him. So that, sometimes, something with medication would be too high and he'd get sick. So he'd have to go in. All of those things were on his own, on his own funds. Like there was not much support for finances for myself or for my uncle. And can you move to the next slide? So these are my other uncles. So I'm going to look at the picture to the right and where it says happy 40th kidney anniversary. So my uncle to the furthest left on that picture donated to my uncle that's beside him. And they celebrated 40 years, I think 2 years ago. They're still alive. There's a lot of issues, like going on with them as well. And part of the reason that I became a donor was because of them too. My Uncle James's selfless act, doing this and, really supporting my uncle. My uncle was only, I think, 18 or 19 at the time when his kidney failed. And so my uncle was the closest match, so he donated. They're still, fairly healthy. They're in their late 60s. I don't know if they're the, with technology back then, their experiences were different from mine. They had my Uncle James, who donated, had a much longer healing time than I did because my incision was only about 3-4 inches. Meanwhile, his was right across. They totally opened him up. So you could see the advances in technology and the differences in from that point to now. So they went through more than we did because they had to, back then too, they weren't supported at all. So when I look at all of these different things that we've both gone through as a family and, supporting each other through kidney donation. So the man to the furthest, I guess, right on the picture is my Uncle Bill. And, he makes jokes here and there. He'll be, he'll be he calls his kidney bear, and bear was my nickname when I was a child. So, there's just been that extreme closeness between he and I. And you don't really see that too often. We just connect. He's a part of me, and I'm a part of him. And so we talk about, some of those things, and we were always talking about, how can we support other people to do this? So I'm like an advocate for a live kidney donation. I talk about all those things, and the part that really people are really concerned about is the finances. Turn to the next slide. So these are the issues we faced. The travel time. So if you're going to become a donor, there's multiple tests. It takes 1 to 2 days a month away. You're not covered for any of those appointments. The time it takes. So if you're working a full-time job, sometimes your work is not as flexible. But I was grateful mine was. They understood what I was doing, and they supported me through the whole process. Distance is a huge factor. If there's surgeries that take place, or the main places to go is Saskatoon from here. I know other places are even way further, especially the ones further up north. So theirs would be impacted even more. Funds, supports for funds, support. Not too many people will fully understand what it takes to become a donor. So like I said, my work gave me that time off when surgery happened. What they also did for me was the week that I came back, they took turns bringing food to my house to support my kids. So we didn't have to cook, or I wasn't doing anything extra, to help me with that healing time. And that happened for about maybe a week and a half. So that was really, I got a lot of support from that place, but not everybody gets that support. The follow-up is extremely lacking. And I'm going to be honest with you, nobody checked up on me after surgery. Nobody. It was me making sure that I was checking up on myself to make sure everything was working the way it needed to be working. But I didn't get a call from anybody. I didn't get any letter to say, hey, come for an appointment, and, let's just check to see that you're doing well. So issues like this, there's a lot of issues when it comes to northern communities. And I think we share these issues, and further up north would even be more impacted, because it just be too costly for them to even try to do this. I think more for me was the follow-up. I was really surprised that I didn't get nobody checking on me at all. I took it upon myself that year to do a yearly checkup, and I do that still, but it's me making sure that I'm taking care of myself. And like I said, no, there was no help for me, and no support from the clinic at all for that. So, those are some of the issues that we face. This is reality for all of us. When we talk about, trying to be an advocate, those are the issues that we're asked. How was it like? Like, I think I've had maybe 4 people that were considering becoming a donor, and the issue for them was, oh, I can't afford it. I'm, low income family, even though some of the trips would be covered, it's just being away and having to stay in a hotel and, at your own cost. Like, those were some of the things that they talked about. The other thing was the amount of times they had to leave. Work sometimes doesn't allow that to happen. So that's part of my story. And I know, like I said, it hasn't been, it's not unique. It's not unique. I know that. But it's, I think it's a celebration too, really looking at some of the things that we do, it took, like I said, 6 months of my life to fully heal, to do what I needed to do, like to get back into the routines, and, to be able to take care of my kids myself. Like the first 2 months I couldn't. My youngest kid was only a year old, right? And then, and every 2 years after that. So it kind of gives you an idea. We had a lot of kids very young that I couldn't fully take care of myself. So even that, my family was really good with us, because they did come in and, help us. But not everybody has that same support. So there are issues, and still a lot of issues that are happening. But I think that was my last slide.
Wow. Thank you, Celia, for sharing all of that information and your experiences with us. I definitely could hear some of my own experiences in your story, and glad I had my camera off because I was ugly crying for a moment there. But what happens when you hear other donors' experiences, and sometimes when they align with yours, and so just want to say thank you for sharing with us. We do have a few questions for you, and so maybe I'll just start with the first one I have that came in. Was you touched on it a little bit, but I'll just ask you, did you feel supported by the people in the donor program?
I didn't. The reason why I say didn't is because there was, other than having the surgery and all that, there was no communication after surgery with anybody. So that really I was so surprised because I thought I would receive some support at least, but nobody contacted me after surgery. That was it. It was after surgery was done, there was nobody from anywhere that really checked upon me other than my family, but like any healthcare provider, not even my own doctors, right? It was me that took the initiative to make sure that I was okay.
Yeah, I hear you. I think in my experience too, I had like a follow-up for like 1 or 2 years, like annually, and then kind of hadn't heard anything and had to take it upon myself to reach out and get screened and get checkups as well for my kidney donation as well. And so I'll just follow up with that. I have another question here from Lindsay. She asks, I was wondering if you could speak about the screening process around kidney failure and if you think an earlier diagnosis could have helped your uncle in any regard.
Yes, definitely. And I could actually speak on behalf of my daughter too. So my uncle, and I remember the whole situation because my dad had called. He was actually going to a meeting. My uncle said that he had been sick quite a bit and he was going to our local providers here in our community, and all they would give him were antibiotics and pain meds and saying, you'll be okay, it's just an infection. Meanwhile, he had a disease, and I can't remember the name of the disease, but it was a disease that was treatable. And by the time, so he was going on this meeting in Regina, but he had stopped in Saskatoon because he said I wasn't feeling well at all. He said I was in a lot of pain. He said I felt like I was going to pass out. So I stopped there and they did all this test, and then he had left the hospital and made his way to Regina. And then when he got to Regina, they called him after. They said, you need to come back here. So he goes back and he was in surgery that day and his kidneys had completely failed already. So they couldn't even do anything. So he was on dialysis for 5 years before I donated. And then my daughter, on the other hand, so she was about a year old. We were going through, she kept getting sick. She kept getting kidney infections after kidney infection in a northern community. And I kept complaining and asking, okay, I need a follow-up. I need to know what's going on with her because she can't be sick almost every month with the same type of issue. And so they finally sent her, she got an ultrasound done. And I remember them calling me back saying, oh, we think it's just air pockets. She's fine. It was about the size of a quarter on her kidney, her left kidney. And so I kept taking her in different hospitals because she was sick all the time. And then we were actually living in Meadow Lake at the time. And then they said, I took her into emergency because I thought she was going to having appendicitis. And she was, how old was she? 7 or 8. And then all of a sudden, the emergency room doctor said, have they ever checked or done anything with her, like to check to see what's going on with her kidneys? I said, no, nobody listened to me. I said, I took her multiple emergency room visits, talked to doctors, tried to get like the second opinions, but nobody was listening. And so she finally sent her to go get the scan done. And that's when we found out her left kidney was only working 12% at the time. And so that's where all the pain was coming from, was that that untreated kidney, and she had I can't remember the name of it, but it's a reflux of the kidney, and it's something that would have been treatable had they caught it on time, right? And so she was at grade 4 or stage 4, and so and now like for our last appointment that we had with her, that one's completely failed now because of the disease that was treatable. So this is common. We have to fight for somebody to listen, and it still happens. Like they're starting to listen a little bit more because they know her condition now, right? So every time she gets sick, she's spent many times in the hospital, a week at a time here and there because and the other part of that problem too is because they've given her so many antibiotics as a child without even knowing what the heck they were treating. She'd become immune to some of those. And she's only 13. So when she is in the hospital, it's really strong antibiotics she has to take for it to even clear up. And, so that's one of the issues we face here. It still happens. I'm very vocal now. Like I'm not afraid to, ask for, second opinions. I'm really kind of having to be overbearing at times, and people get really mad, but sometimes we have to do that to make sure that, we get the care that we need. So in those 2 cases, they were treatable. It was preventable, but nobody listened to either my uncle or myself or my daughter.
Well, yeah, I hear you too. Having experience too of just believe me when I come and tell you that these are my issues, and don't just send me away with pain medications. I've had that experience as well.
Yeah.
So very poignant stories. I know we're getting close to time here, but I do have one more question here that came in the chat, and I think it's really, really good to wrap up. I think everything you've shared. And so we have a question from Peggy. She starts off saying, Celia, thank you so much for sharing your story and your family's journey. In your role as an advocate, what things, in addition to finances, do you find most challenging when advocating?
I think that like in Saskatchewan, here's our whole healthcare process. There's jurisdictional issues even on the reserve and in town. And so when we have those types of issues, so like it's who takes care of the person, right? So if your status, you're taken care of a little bit more. And so my daughter is not status, my daughter Faith. So any type of emergency type of billing. So she had to go on a taxi, or not a taxi, but an ambulance from my house to where the clinic is located, where the ambulances are. We're charged $425 just for that. It's maybe a kilometer away. If she goes to Nipawin, it's about $1,200. So there's issues like that. So we're trying to change the system that we have here because it's not working. It's a very expensive process. The other pieces is having, even in Nipawin, having those specialists there. There's nobody there, right? We have to travel to PA, closest one PA, to even get the service or the care that she needs. But even there, they don't have the proper services. They have some. So Saskatoon. So you see how that goes. Like it's just having something closer. We don't have that, and I don't think we're going to have that for a long time because our healthcare system that's set up here is not adequate for the needs of especially those that are going through renal failure and those that are experiencing issues with dialysis. Nobody's doing home dialysis, and the sad reality here is when I was working in health, which was 2 years ago, there was 12 patients. We only have 3 left. That's how many have passed on now. So it's a really tough situation. We're seeing the decline, because there's no supports, right? And not many people doing live donations or even them being able to get on a list. It's a long list, right? We know that, and they prioritize by, I'm not sure how, but those are some of the issues that we have.
Great. Thank you, Celia, so much for sharing your story, sharing the story of you and your family, your uncle there, and for answering questions. I think there was another question in the chat, but I think we're going to go on to our next presenter. But if you wanted to take a look at the chat, and it was David Nichols who posted something as well around priorities. So if you had any answer to their question in the chat, they'd be sure happy to hear from you in there. So thank you very much. And I just wanted to share with you too that Cumberland House, I have some relatives in Cumberland House, so we're probably cousins somehow. Just kidding. You know, I say we're all related. It's true in Indian country. I think we all are related in some way or another.
No, no.
Yeah, thank you very much.
Thank you for having me.